reason why I chose the Raleigh campus specifically was one, its proximity to UNC. I wanted to experience something that was maybe a little bit different from the patient population at UNC, but still having those necessary connections to our big institution.
Biggest one was honestly free food, free parking, and you get kind of a smaller version of UNC main campus where you still get really good faculty support and it's a good teaching environment.
I chose Wake Med for a couple different reasons. I like the idea that everything was more bread and butter medicine, so getting really good at things like hypertension, heart failure, diabetes, the things that you really see day to day in the community.
When I came and toured this campus, there were a number of older med students who I talked to who went to Wake Med, and everyone I talked to absolutely raved about this place.
Patient population is very diverse in many different ways. I get to see so many different ages, races, ethnicities, people who are, young professionals, people who are families, older people at the end of their careers, retirees, and that's something that I love, that I get to see people in so many different aspects and areas.
The faculty here is just approachable like 100% of the time. Like if you have any questions at all, they're more than happy to address any concerns or anything about medicine, pathophysiology, stuff like how to present a patient, like anything you can name, they're more than happy to help you with.
You get experience working with all aspects of medicine and all health care workers that are important in a patient's care. So not just physicians, but also nurses and social workers and MPs. And I think that creates, that enriches your education as well.
Oh my gosh, there's so much to do around Raleigh. There's like so many different restaurants here that I have honestly yet to try, but would love to try. Different coffee shops. I feel like I'm studying at a coffee shop every other day with some of my friends.
I would say one of the things I like about Raleigh the most is just like the accessibility of parks. So there's Umstead Park, which is enormous. It has like multiple different entrances. I go there probably a couple times a month just for hiking, things like that.
I actually really think that so much of being a physician, now that I get to see it in everyday practice, is knowing and understanding community resources. It's knowing and understanding systems-based practice and knowing and understanding the patient population you're caring for. And I think better than any hospital that I have been exposed to, Wake Med physicians do an amazing job at balancing those three things.